Hello, Carla. Yeah, you're right. Hey, Ange. Jessica, Whisper to Me, and Brian Clan. Hi, did you ever get a hold of Cowgirl, the Brian Clan? What about the boots? I hope that you were able to. Hi, Anna. Hi, Mary Kim. Evie, hi. And how's Zoe? Hi, See Me. Hi, Laughing Lori. Hi, Mimi. Okay, got a call from the vet around 9:45 or something, and hydrocano, and he said that Zoe's the same. Zoe, when they had her in last night, they gave her a shot for the vomiting, but she's still retching. He said sometimes, 4 or 5 times in a row, nothing coming out, not food coming out, little foamy stuff, tiny bit of food. And hey, Earthbound, hey, Seaglass. So he said, I don't know what's going on, but she's happy. Well, he calls her a he too. Okay, so it's not just me. He goes like this. He's happy. He wags his tail. He wags his tail, and but he's got this retching. And then he said, has he been, pooping and stuff? And then I don't know. Jimmy tried to think, and he said, I don't know. Maybe like a little bit since the last time he came in. So he said, well, I don't know what it is. I have no idea what it is. And then he said he called his son, and I'm trying to think now. I'm positive he said his son. And did he say his daughter-in-law? Now, boy, if his son has already graduated veterinary school, that is crazy. His daughter's in the practice. I told you, he's the one, he's got like 13 siblings, and every one of them is a vet, a medical doctor, or like a very high-level nurse. Okay, it's crazy. And his kids are all this. But anyway, so he said something like, I called my son, and I thought he said my daughter-in-law. So, and he said, and they can't find anything either. They can't figure it out. No one can figure it out. So now I'm getting like really crazy. And he goes, well, I'll tell you, I'm going to either have to, if she doesn't get better, what did he say? They're going to give it a little bit of time, because they gave her some different antibiotics and some stuff. And they said, if it doesn't get better, I think by Monday, he's going to scope her again. Because he says, I think she's got to have a blockage somewhere. No, that's what I'm telling you now. Yeah. He said, then I'll have to scope her again. Maybe I missed something. And then if that doesn't work and I can't find anything with the scope, this is exactly what he says. He's a very, I'm going to cut her open. I'm going to cut her open then. And I'm like, oh my gosh. He said, there's got to be something we're missing. So I'm like, oh my gosh. So yeah, it's really crazy. He's done x-rays, and then I asked him about, he said all of her blood work is good too. Because I asked him again about the kidneys. He's like, no, the kidneys are good. I don't know what it could be. I'm like second guessing at this point to bring her down to Oradell, which is a specialized hospital in New Jersey, but I don't know. You bet it's a piece of the glove stuck somewhere? You think it's that stupid glove? He said he just can't understand, because when she's retching, there's only, like, the food doesn't come up, and she's hungry, she eats, he's saying, and then there's just like a little like white foamy stuff and tiny little particles of food. That's it. Maybe it's lodged there along. Yeah, I don't know, Nanette. I mean, no one's had anything like this. That would have probably showed up on the X-ray C glass, yeah. It's not that she's caught, like, I don't know. It's not, it's weird. He said something about acid reflux, too. Something about acid reflux. That's why they're giving her a little time. I'm just praying that something works so she doesn't have to be like, that it is something, hey, Matthew, something, hey, Wildlife, something about just, acid reflux or something. I don't know. And just that she turns the corner tomorrow and she doesn't need any of this. I don't know. It's really weird. Because it's been about, what's it been? It's over a week now. And he's like, she's so happy otherwise. And we're like, yeah, but you didn't see her before. She's a really tough dog because she's this terrier and she doesn't ever want to appear sick or anything. But normally she's like really, really active. That he said something about it, but she's so lethargic that, like, for her, like, he doesn't think she's lethargic, okay? But, I noticed something, and it could have been the Lyme disease. There was just something off with her. Remember when she had the allergies and she was scratching her face? There was something in her that I thought, oh no, what's happened to Zoe? Like, she wasn't acting herself. Like, if you saw her, you'd probably say, oh, she's so fun and so but like there was something like this, like spark was missing in her eyes that's normally there. And I was like, what's going on with her? Are you turning into an old dog or something? Like, no, it wasn't that. I think it was the Lyme disease or whatever. And now I don't know what it is, but he's like, oh, she wags her tail and she's happy and she's this and she's that. I don't know. I'm just like really stressed about it. And then I keep thinking about the other dogs, because now my bulldog, she looks like she has a cold or something, okay? I'm thinking like, oh my gosh, does she have Lyme disease? I told you my little one, it lifts her leg the way they said Zoe did. And we told him that. And he's like, well, lifting your leg is not something just for Lyme disease. We'll worry about that later. I don't know. I'm really stressed. That was a few weeks ago when she had that scratching, right? Yeah. He opens her up. I guess, I don't know. I mean, I'll tell you, we had a bulldog. Oh my gosh, it was a great, great bulldog, American bulldog. And he was 18 months old, right? And one night, he just started acting like he was panting and just... And I looked up in the book and I'm like, oh my gosh, he has bloat. This is called bloat, right? So I took him up to the bedroom with us and I had him in the bedroom. And then the next day, what happened? Jimmy brought him to this vet, okay? And this vet said, I think it's a, what did he say? I think it's a torsion. No, let me see. Whatever it is, he opened the dog up. He took the dog under and opened her up. And he said he closed her up, Pim, because he thought the dog had a torsion or something was twisted, right? But he wasn't prepared to do that. And he said, this is a young dog. You've got to get this dog down to Oradell, right? So dog came home. We said goodbye. Jimmy took her down to Oradell. When they took the dog down to Oradell, they found out, okay, when Jimmy was telling me on my phone, I thought a hernia, right? Oh, no big deal. It's just a hernia. He said, he has a diaphragmatic hernia. I said, oh, okay, just fix the hernia then. No. Diaphragmatic hernia is when all of the insides are coming up through the stomach, and this dog was a beast. They said this dog must have been suffering from this and hid it. That's like how Zoe is, right? Very stoic. And this specialized hospital said, your dog has like, I think it was 2 to 5% chance of surviving the surgery. Okay, 2 to 5% of surviving the surgery. And they said, your dog is in incredible pain. And we had to put our 18-month-old dog down for a diaphragmatic hernia. Oh my gosh, it was terrible. It was terrible. But, gosh, I don't think it could be anything like that. She wasn't acting. I mean, he would have seen something on the x-ray, I think. I don't know. I'm just freaking out now. No, poison? No, he did her blood work and everything. They did kidney function. Her kidney function is fine. Addison's disease, is there a Lyme disease? Yeah, there is a Lyme. It's like inflammation of the joints. They do say stuff about vomiting, but he doesn't seem to be. Oh, the vet called and they said Zoe is the same. I'm going to do some research on it and it's crazy. I'm just looking at your comments. Yeah, I don't know. Well, she's been on different things, but diaphragmatic hernia, how did she get it? There's like a whole, we don't know. It was like a freak thing. But that's not Zoe. That's not Zoe. That was our other bulldog. Hi, Lisa. Addison's, they can't make their own cortisone. But, I mean, would that just affect her at this age? At 8 years old? I should go in my I have a Westie group on Facebook and ask if anyone's Westie has had this. Maybe it just hasn't showed up yet. When the tube in my head messes up, it's supposed to show on scans. No. I was telling a story about my bulldog that we lost a long time ago. But my Westie is not getting any better. You have a dog that was allergic to dust particles. Yeah, but was your dog retching though? She's retching, and she's not acting like herself. Hi Deb, how are you? Did you get any test results or anything? Been praying for you. Hi Nana. Thanks Denise. Symptoms of acute Lyme disease, acute arthritis, swollen joints. Yeah, she doesn't really have that. Antihistamines would have helped. Yeah, and she was on antihistamines. Our pointer retched, didn't want to walk, but did eat and drink. With Addison's disease, but how old? When the last of my furry kids, I'm not doing this anymore. It is also painful for me. Yeah. Well, I'm hoping she's going to be okay. Do dogs get asthma? But it's not asthma. She's not having trouble breathing. Not yet. Have to wait for ultrasound 25th. Oh, okay. Ouch. Yeah, I don't know. He was 6. So what happened, Wildlife? It wasn't a cough. See, that's the thing. It's retching. Even he said it's retching. It's not a cough. He has her right there doing. He said it's retching, not a cough. Hey, Tom Rose. Yeah, that's what we're talking about, Danielle. The vet called and he said that she's not any different and he doesn't know what it could be. If they've got her on some different antibiotics and a couple of other things, and if she doesn't turn the corner by, I think, Monday, he said, he's going to scope her again because maybe he missed something. He said she's got to have a blockage somewhere. And if that he doesn't find anything then, he said, I'm going to cut her open. Retching torsion of the intestines. Oh, don't say that, please. Oh my gosh, I can't go through that again. It's not something in her lungs. They've done an x-ray. It seems like it might be more than Lyme disease. For a couple of years, we got him cortisone shots, applied for help. He got his rabies shot and died. Oh my gosh. Oh, that's crazy. Sorry. The twist can be a sign. A dog treat. All right, well, I'll write it down and ask him here. Let me see. I'm going to write that down. I just think he would know about the torsion because he's the one that told us about it in the Bulldog. Yeah, and I've got to go to the Westy Grove. Okay, so any of the following: vomiting. Yeah, but it's been over a week, snow remover. It's been over a week. No, I mean, not the lake water, no, not. It was weeks ago the last time she swam last. And the water's very, very clear. We have it tested all the time. Our water is tested constantly. The Lake Association tests it 3 different areas. We don't have anything like that. No, we don't have algae in our lake. We don't have any of that. I don't know. Anyway, I don't know. I'll put something in the. Your friend who had the dog with the cork stuck had more than one x-ray. They missed the cork the first time. Another x-ray might help. Do your dogs leave the yard? No, they don't. We have electronic fence. It has reached the intestines. I don't know. I just wish it would pass. And okay, I'll ask. I don't know, just weird. I'm just like, I'm second guessing myself because I don't know if I should take her somewhere else before, or you really think it's the glove? I don't know. We told him about the glove. It says that surgery is necessary for what? For what, Sonia? What surgery is necessary for what? If it's reached the intestines? Get another x-ray. Yeah, I hope so, Nanette. I don't know. All right, let's get on to the trial over here. The rest of, hi Jeannie, the rest of day 3. I'm telling you something about, tell him again, do you have the rest of the glove? I think so. If we don't have the rest of that glove, I mean other gloves like it. You know. Thanks, Robbie. You say that every time. I'm like really great. Anyway, let me just tell you before I was, I sanded a coffee table twice today. The croup, yeah, but it wasn't a cough. See, it's retching. He even says it's retching. Hi, Brenda. So it's going to be in a video, but I sanded it twice. Why did I sand it twice? Because I did something wrong the first time, and then I stained it, and then I sanded everything off again. And then I took a bike ride, and then it got dark when I was bike riding, and I had to stop. What about his sinuses? They're all fine. I'm like freaking out because like all of my dogs now, my bulldog looks like he has a cold. She has a cold. I'm worried to death about my Maltese, that she lifted her leg, that she has Lyme disease. I'm just like, I'm out of my mind right now. Okay, Mr. Tree Seeker. And I'm like, what the heck is going on? Because I don't know. Hey, Dawn. Okay, so this trial, okay, it's really aggravating me. It's too much. It's aggravating me because I'm trying to think of other trials. Yes, I'm just going to get to that, Danielle. It's even the prosecution, though. I mean, I see what they're doing. They're doing it because the way the defense is, but it's getting ridiculous now. So even if said this, then it doesn't mean that. No, they go over, and then the defense goes over. You know, like he's going to go over every single. Then they're going to redirect over and over the same, and the fund. It's getting crazy. I watch it on different things. I actually watched some of it while I was biking because I have the holder for my phone on my handlebars, and I put on a YouTube. I think it might have been that other one, Scales of Justice or something, and I put it on and I was listening as I was biking, but then I couldn't take notes, so I had to re-listen and take notes again. Hey, J-Bells, how are you? J-Bells, I don't know if you're getting my text. I didn't get into the WhatsApp yet. I don't think you're getting them. This judge needs to stop. It's ridiculous, isn't it? And the jury just must be like, come on, come on. And the defense with, no, just read the highlighted areas. He's such an arrogant, oh boy, the witnesses, I don't even know how, oh boy. Yeah, I don't want to beat a dead horse. I have that written down in here, Danielle, but I'm just going to beat it just for the hell of it. I don't want to, but let's beat it again. Yeah, he's horrible. He's such a, you can see, oh boy, condescending. I put that in here, arrogant. Yeah, when I get to it, I'll tell you, yeah. I write down little things about them. Totally arrogant right now. So they had Krista Latham come on, right? And they go through, where do you work? University of Indianapolis, right? She's the director of human identification. She oversees forensic casework there. She has a lot of different degrees. She has her Bachelor of Science, I believe it was in biology and chemistry with a cum laude with honors. She has like 3 different master's degrees. She has a PhD in anthropology. So she studies forensics and molecular anthropology. She studies humans on a molecular level. She studies human DNA, so she's very qualified. They go all through her credentials, and then they say you identify things from people's bones, right? Yes, I can tell if they're injuries, what age they are, whether they're female or male, their ancestry, all of that stuff. It depends on, his pen clicking, I know. Age and trauma, if trauma contributed to their death. And she testified in many different states, so they qualify her as an expert. The defense says okay. Let's see here. Then she also has the highest board certification in forensic anthropology, and she's got the highest level ever that you can go in there. And so she's quite qualified. So she was requested to look at the skeletal remains of the baby and to analyze the age of death and to look for any trauma. Okay, and then let's see, the bones were transferred over to the University of Indianapolis where she works. And what is the first thing you did? The first thing I did, I took an inventory of the bones to document for chain of custody. And then she had a PowerPoint presentation that they put up, okay? So in this PowerPoint presentation, what were the bones that weren't present? Well, there were 3 ribs missing. There was 4 vertebral arches missing, 8 manual phalanges, and then the left tibia and fibula, and then all the bones of the ankle and feet. Okay? All right. Other than that, you had a complete set? Yes. Okay. And so what is the next thing that you did? Well, usually it would be that I remove soft tissue, but I wasn't granted permission to do that by court order because others needed to observe this the way it was. And they said, what did you observe? She said, all bones where some soft tissues, especially noticeable on the head, 3 to 5% of those bones that she had, she was not able to analyze those surfaces anywhere where there was this soft tissue. Hi, Jennifer. Hi, Giovanna. And so then she said she assessed the age of death next using different techniques, bone measurements, developmental changes, and the teeth developing. Now, I'm wondering, when she was talking about the teeth, if any of those things that somebody thought were small rocks were the teeth, just based on what was there anyway. So all the bones, every single bone she measured, the left humerus, the scapula, the clavicle, okay, the ulna, the radius, the ilium, the ischium, the pubis, the femur, and then those were all from the left side, and then the right tibia and the right fibula, all measured 38 to 40 weeks. So that's a full-term baby, okay? The fusion, then she put up another slide, that occurs by 35 weeks. All of those bones that needed to be fused by 35 weeks were fused, showing the age was at least 35 weeks. And then there was fusion of bones in the skull that are consistent with birth plus or minus 8 weeks. So based on those three things, and the dental development, okay, was consistent with birth plus or minus 8 weeks. So let's see. So what that would be, if you did the plus or minus, it would be 32 to 48 weeks, okay, for the dental. And this all led to her findings that the infant was approximately full term at birth. She found no trauma to the bones occurring before death, okay? Only post-mortem. And then the prosecution said, would you see trauma if the baby was suffocated? Would you see trauma in the bones? No. Would you see trauma to those bones if the baby was drowned? No. Okay. Any thermal damage? No. Could you say that you would see thermal damage if there was only burning of the soft tissue? No, she couldn't say that. You know, it is possible that the soft tissue could have been burned without damage to the bones. Okay, hi Karen. Then let's see. They asked her about a report from Dr. Sims, the defense expert. Yes, she saw that, and we came to the same conclusion is what she said. Okay, no further questions. Cross-examination by the defense. Okay. Bottom line, we're not going to beat a dead horse. Okay? All happened after regarding the bone fractures, correct? Yes. Okay. Then he asked her, date of report is June, or is it January 26th? And then you only sent your report, okay, to the prosecutor. You did not send it to Dr. Brown. Correct. She said, I sent it to the prosecutor. Okay. And then he says, hey, Dr. Sims, right? You said he has a great reputation, right? And then she says, it's not my job to qualify other experts. And then he's like, okay, whatever. And then lunch break. Okay, that's it. That was it for her. So they have their little, where they took the jury out, and then they talked about this PowerPoint, and the defense says, can we admit it as a joint exhibit? Because if we do that, we don't have to bring in Dr. Sims because she agrees, and if you hadn't brought her in, we would have brought her in, so can't we use it as a joint witness and use her PowerPoint as a joint exhibit? And so they agreed to do that, and he's saying, oh, it's going to save time because then we don't have to bring in Dr. Sims, right? And he wanted to have a sticker, yeah, on the PowerPoint saying it was a joint exhibit, right? Okay. Now, next witness is William Brady. Okay, he's a physician in maternal fetal medicine. So they asked him exactly what that is. He said there's 4 subspecialties in OBGYN. Okay, there's urogynecology. Then there's, what did I put down here? He said GYN oncology, infertility, and then maternal fetal medicine. And he's maternal fetal medicine. Okay. So they go through where's he employed, okay. and he is employed. Let's see, where is he? He's got a lot of things going on here. This guy. He did his undergrad in West Point. He did his med school in Baylor College of Medicine in Houston, Texas. He did his residency in Fitzsimmons Army Medical in Denver. And then they went through his licenses, his board certification. He's very, very, very qualified, okay? They kept going on and on. It's kind of crazy. So they started talking about the lag in growth, okay? And what exactly is that? Well, he said any baby born less than 6 pounds could have been intrauterine growth restricted. Not always. Sometimes it's just genetically a small child. Well, what does that mean, genetically a small child? We look at the parents. Are they small? If they're small, then their child could just be genetically small. And it doesn't mean that they were growth restricted, okay? So you've got to look at the parents. That's one of the ways. But that child could just be genetically destined to be a small child. Okay. So now, what would that mean? A smaller than average mother would come into play? Could the size of the mother come into play regarding the baby being small? Yes, that could be. Okay. And how do you diagnose intrauterine growth restriction? Most commonly, they do it through an ultrasound, he said. They measure the femur. They measure the head, both the diameter and the circumference. And they also look at the abdominal circumference, and the abdominal circumference is very, very important because that's one of the first things to throw off everything, okay? Why is that? He said because babies will gain quickly and, just like adults in the abdomen, and lose quickly there. So they have a software program that calculates these measurements and gives them a weight and the percentile. Now, if that weight is less than 10% in the percentile, they will then look into IUGR, okay? That's inter-youth growth restriction. So you take many measurements, correct? You wouldn't do this with just one measurement. No. And then he explains that the abdominal measurement is the first thing to fall off as an indicator. So you can't make a diagnosis with just one measurement like this Dr. Andrews, right? No, can't. Okay. So if someone comes in, he starts to explain why you can't just do one thing. If someone came in and never had prenatal care and they could be 32 weeks pregnant, but is she really 32 weeks pregnant? Or could she be 35 weeks pregnant with an IUGR baby? Or could she be 28 weeks pregnant? So he said there's just too many variables if someone has no history of prenatal care. And the error in the ultrasound for dating is 10 to 14 days. So up to 2 weeks, they could be off. So if he said 32 weeks, he could be 34, she could be 34 weeks, okay? But with just the one measurement, you can't tell. You have to repeat the ultrasounds 2 weeks, and then you'll know no matter what. No matter if she's off with her period and she's 28 weeks, or she's 32 weeks, or she's 35, if she comes back in 2 weeks from that date, then they'll see the baby should have grown 2 weeks. Okay, if the baby, that's what he's saying. It doesn't matter if the baby didn't grow 2 weeks from whatever period it was, then there's an issue. Okay, so then they would check that out. But she didn't go back. We don't have that information, so we don't know anything about that. Okay. So then she goes again, okay, by taking only one measurement, by looking at just the fundal height, okay, could you make a diagnosis of IUGR? No. Why is that? You can't do it from the fundal height because it's a screening test. It's not a diagnostic test. Can you give us an example of that? Yes. If you go for your pap smear and your pap smear comes back abnormal, chances are you don't have cancer, okay? but it just means that you need something more diagnostic, like a biopsy or something else, and more than not, it's going to come back, you're okay, but that's why the pap smear is just a screening. There's error in it, there's all that stuff, right? Okay. Let's see. So then he also says, the next thing, the fundal height, okay, is quite accurate up to 20 weeks. She was after 20 weeks. The further you get into the pregnancy, the less accurate the fundal height is. Has an error rate of about 3 centimeters, but there's even more error because if the baby is engaged head first, okay, the fundal height starts to drop. And so while he could have measured her, you know, she said, and then if you took it with your hands, you have a further margin of error. Yes, we have a bigger margin of error than using a tape. But anyway, let's say that 32 centimeters has a 3 centimeter error, but if the baby's engaged, it can be even more off. So she was trying to say, well, you know, she could be maybe as much as 35, maybe even 36 weeks. And then, you know, close to 38 weeks when she delivered, right? Yes, okay. Now, what is the error rate, okay, using fundal height in the 3rd trimester? 60% of the fundal heights are wrong. 60%, okay? If the head down, that's greater. So only 40% of those fundal heights are correct. And after 30 weeks, they are generally wrong. Okay. So the error rate would increase if you used your hands instead of a tape? Yes. And if the baby was head first and is lower in the pelvis, your fundal height was going to drop, right? That's not contingent with... So, if it drops, that doesn't mean intrauterine growth restriction. They kept going over this. No, it doesn't. Okay. Is it possible based on fundal height to make a diagnosis of IUGR? No. Okay. Is it possible to measure one bone in an ultrasound and make a diagnosis of IUGR? No. What if you had 2 tests in one day? No, you can't have them in one day. You need to have them about 2 weeks apart. Okay. Now, she asks him, does everyone that has a baby with IUGR, does that result in stillbirth? And no, it doesn't. Most are born alive. Okay? And so if someone has IUGR, that you don't make the presumption that that baby's going to be stillborn. No, we don't. Okay, then she says, what is your dealing with the babies that have IUGR? Do they survive birth? Yes, they do. What do? Well, we do a number of things. We induce labor if the baby's ready. We do fetal testing to prevent stillbirth, you know, and all kinds of stuff like that. Okay, right? So she goes on. All right, again, she asks him again. Did you get, when you looked at everything to diagnose or to make an opinion whether Skylar had IUGR or that her baby was stillborn, did you look at all of these things? The coroner's report, Dr. Murray's report, Dr. Latham's report, OBGYN records, school reports, other doctors from her youth, police reports, interrogation, Dr. White's report? Yes. Okay. And were you able to make findings and of, what did I put there? Sometimes my shorthand is crazy. Your findings, up for these 2 issues. See, I found it, 2 issues, that's what it is. Yes, he said, okay? So he said she said, was there sufficient evidence to support a diagnosis of IUGR? No. Okay. Do you know that only one measurement, the fundal height, was obtained by Dr. Andrews? Yes, Andrew. Do you know that he performed an ultrasound? Yes. And based on those, why can't you diagnose IUGR? Because it is only at one point in time, he said. So you need a subsequent visit? Yes, best to have it about 2 weeks apart. Okay. And then, let's see. You know that they estimated her to be 32 weeks? Yes. The 60% error rate in the fundal height, and with the baby engaged, increases. They kept hitting these things, and the error rate again. Baby was head down, correct? Yes, yes. So that's going to make it more inaccurate, right? Yes, yes. Any indication of date of conception in the record? No. Let's see. Did it say if the doctor... Let's see. Doctor, if all we have... Oh, she's saying if all we have is what the doctor used to measure the fundal height, we could take this baby to be 35, this pregnancy to be 35 weeks at the time she was there. And if she was born 2 weeks later, 37 weeks. Is that an indication of lagging growth? And he said, no, it's not. So she said, but she could have been 35, 36, 37 weeks when she was at the appointment with Dr. Andrews, correct? And if born after that, she could nearly be 38, 39 weeks even. Yes. And so do we have a lag in growth on that? No. Can IUGR be diagnosed from weight gain? No. Okay. So the weight gain does not correlate with the fetal size. So she says, you know, we have no weight for Skylar in the month of August 2016. Okay. And he says, correct. And we have no weight for her September and October and November and December and okay. They have a weight for her in April. Okay, and he said, and then she has, let's see here. What about weight fluctuations? Were you aware she had weight fluctuations due to her eating disorder? Yes. Okay. And you have no idea what she weighed until she was weighed in April, right, of 2017. Correct. And do you know when her belly started protruding? No, I don't. You know nothing regarding her weight, right? And a weight gain of 15 pounds, could that have been used to diagnose IUGR? No, it can't. So then, let's see, something when pregnant, the nutrition, okay, so then they hit the whole thing, like what's the umbilical cord, what's the placenta? The baby gets the nutrition first, and then the mother gets what's left. So let's look at her blood work, okay? If she was malnourished and only had a 15-pound weight gain, like this other doctor's saying, so he says, let me look at her blood work. The hemoglobin and the hematocrit would be the first thing to dip down if she was malnourished, and she's not anemic, and her numbers are good. So he would not think that, okay? So she's not even close to anemia. Right. And then they talk again about the ultrasound that was performed. By the time the baby reaches 32 weeks, if a baby is IUGR, okay, they can have visible dysmorphic features on an ultrasound, correct? They can. And Dr. Andrews didn't note that he saw anything, correct? No, he didn't. You could also see differences in fluid and whatnot, yes, but, you know, nothing was noted from that ultrasound, no. Okay. Any indication, do you have any indication that Skylar had IUG, or her baby had IUGR, right? No. Do you have any indication from anything you reviewed that she gave birth to a stillborn baby? No. Okay, so now they go on the cord. What about her saying that the cord was not attached? Does that mean that her baby was stillborn? No, it doesn't. Okay? A live birth in the state of Ohio does not rely on the cord being attached or unattached, right? No. Then she said, what about the water breakage? He said, well, no, it doesn't really matter because sometimes people don't even realize their water broke, okay? And if you have water breakage with a bloody show or something like that, it could turn the water red. You could think you're bleeding, not even know that you broke your water, okay? So that doesn't make any difference to him that she didn't know or knew that her water broke, okay? And they said, well, what about if she had a little bleeding? Does that mean she was going to have a stillborn? No. 1 in 5 women have bleeding during pregnancy. It's due to many issues, hormones, etc. Then the prosecution says, could vigorous exercise cause bleeding? Yes. Okay. And you heard the police interrogation where she told the officers that she felt the baby move. Yes. I mean, and then do dead babies move? No. Okay. If she felt movement, is that indicative of a live baby? Yes. Okay. She worked with children in this, what is it, the YMCA or something, right? So she had knowledge of children and she knew about babies a little bit, correct? Yes. Okay. So she said the baby made a noise, that it gurgled, that its arms were moving. She only said she saw her alive for about 5 minutes, and that was prior to her squeezing her daughter. And she said that she was crying before she squeezed her, just a little. And do babies cry, gurgle, and move their limbs if they're not alive, if they're stillborn? No, that's not an indication of a stillborn baby. They're actually asking this stuff. Okay. The other thing is, did they ever play for the jury the other part of that police report? The one where she admits all this stuff? Because I don't think they have played that yet. Or did they? Because if they didn't, this must be very confusing to the jury. Okay. Not yet, right? That's what I thought. Well, that's kind of weird, isn't it? And yet they're talking about it. Okay. Okay, so given the report that Dr. White, the OBGYN, okay, he's just an OBGYN, right? He's not a maternal fetal specialist like you, right? And he comes to you for, your expertise. He gets you to consult when he needs to go to a specialist. Is that true? Yes. Okay. So you have 2 reports from Dr. White. Correct. And what he said differs from what you say. Correct. And you would take into consideration anything that differs from what you say, correct? Yes. Does it change your opinion reading his 2 reports? No, it didn't, he said. And then she says he made a diagnosis that it is likely that Brooke and her baby suffered from IUGR and was stillborn. Okay? And he said on February 7th in his report that this was a full-term female at 39 weeks based on the femur length, post-mortem measurements. And based on 39 weeks, he was guessing that conception occurred on August 21st. And this Dr. Brady says, yes, that's consistent. Okay, he believes that her pregnancy was likely complicated by IUGR based on the 32-week measurement and her having a baby 1.5 weeks later. That he says there's a 5-week lag. Do you agree? No, he said. And why? He said because of the inaccuracy of the fundal measurements after 30 weeks especially. So she says it could be up to 37 weeks with error close to full term, right? Yes. So that's not a 5-week lag. No. 32-week fundal height. He does not mention the baby is in the down position with his head down, engaged in, going to the birth canal. No. The weight gain, he used a sports physical from July where she was 136 pounds. And he then used the April 149 pounds to say she only gained 15 pounds through the pregnancy. But that's not accurate because the baby wasn't conceived in July and her weight went up and down. We don't know. We have no way to know that, right? No, we have no way to know. Okay. And significant likelihood, he said, to have delivered a stillborn. Do you agree with that? No. Did you see any of that in any of the records that would indicate that to you? No. He says there's something with the lack of her water breaking or no gush, no leakage of fluid. Is that correct? Do you see any? No, I don't see anything to indicate that. We already went over that. Okay, let's keep beating the dead horse. Is there anything in the records to show any dysmorphic features? Okay. Or of any of the amniotic fluid shouldn't be as it is? No, nothing. Okay. So then he goes to the cord, right? He accepts her statement that she didn't know whether the cord was attached or was. He says it makes absolutely no difference in this, okay? Is that a diagnosis of stillbirth if someone says there's no cord attached? No, absolutely not. So she not knowing whether it was attached or not, okay, if the baby comes out with the cord not attached to the placenta, that doesn't mean a stillbirth? No, it doesn't. Okay. Would you know when it became detached? No. So it could have been attached to the placenta, and then it could just not be attached to the placenta, and it could have happened at the time of birth or before. You would never know, right? No, he said. So she says, is it easier to cut the cord or to break the cord? He said it's much easier to cut the cord because they're using sharp scissors. And let's see. Cord, the cord is, he said, the cord stretches. We actually clamp the cord. We now cut pieces of the cord routinely and send them out for drug screens. I didn't know that they do that. They do that. He's saying that they do that in all cases now over there. And he said, while it's possible to break away, it's, not very common in birth as it is in a hospital. But if a person was giving birth while standing up and the baby was falling more than 2 feet, yes, the weight of that baby could rip that cord away from that placenta. Okay, so it's possible to break it away. And what if the person was sitting down on a toilet? Yes, it's possible, but sitting down on a toilet is not 2 feet. I'd say I really don't understand how that, but okay. So yes, it would be possible if the baby was falling if you were sitting down. So does that mean the cord was broken prior? No, it doesn't. Okay? So if there was no one there to catch that baby, as I understand, there was not supposed to be, according to Skylar's testimony, okay? And she goes over ways that the baby could drop out, and not only drop out, she says if the baby dropped out and then she picked the baby up and held the baby, could that have pulled the cord out? Yes, that could pull the cord out. Okay. So the fact that the cord may or may not have been attached, can you attach any significance to that? No, I can't. Okay, then they go over the color of the child. She said the color of the child is white. Does that have any significance? Does that mean it was a stillborn? No significance. He said some babies come out blue, some babies come out pale, some babies come out pink. It doesn't matter, but they can all have a normal heart rate, okay? So she says, you must have delivered many stillborns. Yes, I have, unfortunately. What colors are they? Some are white, some are pale, some are gray. It doesn't matter. You can't just go by color. Color alone, you cannot understand that baby's a stillborn on color alone, okay? All right. What about a short labor? Does a short labor indicate a stillborn baby? No. And then she said, are you aware that she said she had cramping and back pain from her statements going on throughout that whole day? She was laying on the couch with a heating pad and she was in a lot of pain. Yes, I do. Okay. And so she knew what was happening, right? Yes. So if you take all that into consideration, was that a short labor? He said, no, it was pretty typical. It didn't seem short. Okay. So then she says, Dr. White concludes that the gurgling heard was due to the mammalian dive reflex. So any gurgling is just a matter of being born in the toilet. And he says, absolutely not. There is absolutely no gurgling in a stillborn. Okay? And then the prosecutor says, so dead babies don't gurgle? No, they don't. Okay. Then they took a break right in the middle of that testimony. They came back, okay? And she has him read a letter of his opinion on this thing, okay? So she goes through everything about what is in there, what he referenced, okay? Everything we went over before, the Hilltop medical records, the coroner's report, Dr. Latham, the sports physicals, the school records, blah, 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 the defense expert. And then the hemoglobin and the hematocrit being in the normal range. The average duration of labor, he said, is 8 hours, and it does not correlate to size. He, given all of that information, cannot determine that the fetus had either suffered from IUGR or was stillborn. Now, the second report by the defense expert, Dr. White, okay, he went in there at about Cincinnati Children's Hospital, and then the judge says, no, stop, or okay, so then they just lost that type of questioning. And did any of that change your opinion? No. So based upon your review of the case, did you find it medically possible to make a diagnosis of stillborn birth? No. Do you have your opinion? Can you base your opinion to a reasonable degree of medical certainty? Yes. Okay, then the cross-examination. So Papa defense, Daddy defense says, you've never spoken to me, right? We've never spoken? Not to my knowledge. You've been paid by the prosecutors, correct? Yes. What have you been paid? Nothing so far. What is your fee? Well, our fee is $5,000 a day for our testimony because it's the amount that we're missing when we're away from our practice. Okay, but you're also putting in hours, right? Researching this stuff and writing your reports. You charge extra for that, correct? Yes. What do you charge? $500 an hour. Okay, and how many hours have you put in? I don't know. My secretary keeps track of my hours. Oh, okay, good. So then Daddy defense says, I heard Ms. Kraft asking you about testifying in other cases, and that you said you primarily testify for the defense and not the state. But you mean in civil cases, correct? Yes. Is this your first penal case? Yes. And in the defense that you're testifying in those cases, they're for doctors, right? For medical malpractice, is that correct? Yes. Okay. So you say Dr. White is all wrong, but you know he's very respected, correct? And you are aware he was an expert in the trial where two of your residents were sued in a malpractice case where you were the attending physician. And Dr. Brady says, I don't recall that. What year was that? And Daddy Defense says, great question. I didn't bring that. I brought the one that doesn't have a time copy. So then the timestamp copy. And then let's see. He says, but TriHealth is your group, isn't it? He said, that's my employer. Oh, your employer. Okay. And you at times serve as an attending physician, correct? Yes. Well, I don't have any timestamps on this actual case here. And then Dr. Brady says, I have never been in court for any type of malpractice case for myself. And then he gets real nasty and he says, I did not say it was you. Okay? Are you aware of when your residents get sued? Okay, so, he said, I'm not aware of what you're talking about. If I told you that Dr. White was an expert, would you disagree with me? No. Okay. And you're a member of ACOG. What is that? American College of Obstetrics and Gynecology. Okay, and they publish a bulletin, correct? Yes. This is he just got, and this bulletin is very important. You as an obstetrician and gynecologist and other obstetricians and gynecologists rely on it, right? Correct? Yes. Okay. Did you ever write for this bulletin? No. Okay. So I'm going to draw your attention to a bulletin that was originally, an article in the bulletin that was originally written in 2013, but here you see that it was reaffirmed in 2018. So that shows that it's current, correct? Correct. And they say, okay, there's clinical recommendations here, right? I want you to read that. Read the whole art. No, only the highlighted area. Okay. So he says if the fundal height after 24 centimeters, if you find a 3 centimeter discrepancy, it could potentially be IUGR. And so if it's a 3 centimeter lag, you need to check this out further in essence, okay? Then he says next paragraph, and read it slowly so that the jury can understand what you're saying. So the next paragraph sounded like a bunch of gobbledygook to the jury. I know that it did, okay? But what the defense thought it said was that the screening methods aren't any better than the fundal measurements. They're just as good. Isn't that true? And then the Dr. Brady said, no, that's not what it says. It says that screening methods are just not improving the outcome of these babies that have been diagnosed with IUGR. Okay? So then he starts going into the perinatal morbidity. So he has them read a couple of things, okay? But they're all about people, mothers, who have been diagnosed with IUGR, okay? And so it's not relevant to what is going on here because Skylar was never diagnosed with IUGR, okay? And so he's just having a fetal death in utero, and neonate morbidity. What is that? Neonate is from 1 to 30 days. Okay, so but this doesn't relate. And this, all the defense is trying to get it to relate. Okay. So now the judge interrupts. I don't know if it's due to the lateness of the week, but I can't hear. Can you guys speak up? Okay. So then he says, sorry, Your Honor. I've got this draw. What is that supposed to mean? There's a draw separating him from the microphone? Daddy Defense said that? It drives me nuts that they don't always show both. Like, they'll just stick it on. They don't pan it around a lot sometimes. Okay. Now, did he have a draw in the way of the microphone? I don't know. So then, let's see. The causes of fetal growth restriction. Well, we were reading that. It said placental cord abnormalities, right? That's an indicator of fetal growth restriction, correct? And he says, no, it's not. Fetal growth restriction and the rate of stillborn, he says, and then in the discussions in that bulletin, doesn't it say that fetal growth restriction and the rate of stillborn doubles, correct? It doubles then in the general population. And I said, who cares? She did not have IUGR. It's not been proven. He's grasping at straws. These are my things. He's nutty. He's an arrogant SOB. Keeping accurate records are important. Yes. Dr. Andrew, what do you think about him writing that height of 32? Would you take that as accurate? Do you think it was accurate to him? Yes. Okay. Info provided by the prosecution to you, right? Yes. Okay, well, I don't know, and I'm sure she intentionally didn't hold it from you, but I don't know if you saw a report from Detective Carter and Lieutenant Fine. Did you see that when they interviewed Trey, the father of the baby? Did you see that? No, didn't see that. Oh, okay, didn't see that. Let's bring it up now. Let's bring that report up now. Okay, good. They went to Trey's house. His mother answered the door, okay? He stated that they talked and they did stuff around late July and the first week of August, and then she blocked him on social media, and she has not talked with him again, right? So they messed around. You got this? This is the Daddy Defense. So they messed around, and, do you think that when they messed around, that was important? Yeah, no, I know, Earthbound, yeah. Do you think that's important? Because when Skylar Richardson went into the doctor at April 26th, do you think she was between 39 and 40 weeks pregnant based on what he said there? If we look at the last date, this is what he says. We look at the first week of August and we say August 5th and we look at the last date. Okay? But this is stupid. This is stupid because we don't know if she didn't get pregnant that very end of July. And what did that very end of July mean? Could it have been July 20th? Because if it was July 20th, if it was July 29th, okay, so that was getting me really, and I can't believe the doctor didn't say that. We have no idea, okay? So This guy's bringing it to the last possible date and saying August 5th. Okay, that August 5th was the date of conception. We don't know that. And then he's trying to say that there would be a 7-week lag according to the measurement. Wouldn't that be helpful had you had that data? And he said it could have been. Okay. Okay. And are you familiar with the Reed method? No, what's that? Oh, it's an interrogation technique. No further questions. Okay. Then the prosecution does a redirect, right? Dr. Brady, Daddy Defense asked you to read only a few lines of those articles from that bulletin from the American College of Obstetrics and Gynecology. But those lines were speaking about mothers that had a diagnosis of their babies having IUGR. Is that correct? Yes. So that's a no-brainer then. It does not mean that you will have a stillborn, correct? Even if they had this, but that it can increase the chances of a stillborn, correct? Correct. And umbilical abnormalities, how do they relate to IUGR? Is there anything to tell us that Brooke had this? No, nothing. And it's not a direct correlation between the umbilical abnormalities and IUGR? No. So if the baby drops, the cord can be severed by itself, correct? Yes. Okay. Regarding IUGR, and you said that babies that are small are not necessarily IUGR. Some of them can be premature, or some of them can be constitutionally small. What does that mean? Oh, they're genetically destined. Okay. In the case of Brooke, would you say she has a small stature? Would you say she's a small stature female? And then they made her stand up, and he looked at her, and he said, I would say she's thin, but I'm not sure of height. And height is what we're talking about. Okay. So the defense saying that there's a 7-week lag due to this fundal measurement that could be off by 3 to 4 weeks. And that's why nothing more than it's a screening test, that's all. And with the baby engaged head first, it could be off by even more. She could very easily have been 36 weeks when she saw that doctor. And that would put her, she could get close to, with some more error with the baby being engaged, she might even be 38 and a half weeks by the time she gave birth. So, that's full term, correct? Yes. Okay, so that's why it's only, you can't diagnose that age just by that screening tool, correct? Correct. Okay, and 38 and a half weeks is not diagnostic of IUG or stillbirth. No, it's not. Okay, so nothing definite to talk about IUGR or stillbirth? No. Then the defense has a redirect. The umbilical abnormality can be a symptom of IUGR, can it not be? And the doctor said no, and he said, but we just read, and then he said, so it could be a symptom or a cause. That's the doctor finally said that, okay? It could be a symptom or a cause. It doesn't have to be. No further questions. End of the day. The judge then said he's not creative. He doesn't know how else to tell the jury their instructions. I thought maybe he could come up with a little song, dance, or a rhyming chant. I don't know. Maybe like when you go to the theater and the popcorn and stuff walk by and it's like, no talking, please. Maybe he could have something like that on the screen behind him. I don't know. Just if you're listening, if you, I don't know, you're not creative, you asked for help. Okay. And why is he talking to the jurors like they are absolute morons? What was that other case that they talked to the jury, they spoke to them like they were absolute morons? What case was that? The one that they had to keep reminding them to take notes, that it's important, please take notes. Was that the Tim Jones class? And then he tells them, stay away from the Eagle Ridge address. You better stay away from there. Don't get on that internet looking for stuff. Don't start discussing it. Was that what it was? Yeah, is that the one it was? Okay, so that's all I have. Or maybe it was the McNabb. It might have been. Yeah, I think it was McNabb. Yeah. Oh, God. Yes, I think that's what it was. Yeah, they kept, like, you could tell, like, you didn't see the jury, but you just imagined like they were just like totally zoning out or something, and they're like, hey, you might want to take some notes. That was really bad. That was the worst I've ever, yeah. They were. Insulted your intelligence the moment he started clicking his pen. I'm just looking at your comments because I can't look at them when I'm talking. They can only prove her baby was buried in the backyard, not even when she was buried or by whom. Correct. I found guilt on, at the very least, involuntary manslaughter, gross abuse of a corpse, tampering with evidence, up to 9 years, and child endangerment, and that's another 6 months. They're private liars. Defendant is not presenting well despite her excellent defense, especially the young guy. She is likely a serious loose cannon. So are her folks. My lawyer always says, it's not what you know to be true, it's what you can prove in court, right? The defense attorney badgering everyone. When I was 17, I think they were doing a good job. I really don't think they proved for sure the baby wasn't stillborn. Hopefully the jury sees through it. Ask the boyfriend. I just can't believe the prosecution didn't go over that line and they let them get away with the last day of August that it could be. And they didn't say, well, what about the earliest in July that it could be? I thought she was figuring that out. She needed one of those little circles that they have and give the dates. Because isn't it add 10 days and go back 3 months? That's from your last menstrual period, correct? So it could even, depending on when her last period was, and if she, let's just say July 20th, she was ovulating, and say that was the 14th day of her cycle where she got pregnant, okay, then she would have had her period, the last one, July 6th. which would have put her to April. She could have been, because April 16th, right? Is it 8? What is it, 8 days? Because no, I remember with Ethan like crazy, because my last period was July 2nd, and I was due April, I thought the 9th. It's 7 days. It had 7 days, right? But then the lady said I was due on the 10th. But it's 7 days. So she would be due April 13th. She could literally be. Why wouldn't they show that? If she was April 13th, okay? And then it was when did she go there? The 24th? She was already 11 days late, and then she gave birth 11 days later, okay? That's a late full-term baby. Why wouldn't they have shown that? They had the baby May 7th, right. But what I'm saying is, I have phantom Zoe here. I keep thinking Zoe's at the door, Zoe's here. It's driving me crazy. The days they had sex, yeah, why didn't they? And why didn't the prosecution say, wait, why are we saying the last possible day in August? Of course, that's to benefit the defense. Well, why not the first possible day in July? And then at the one time, I forgot to say that the Dr. Brady said, well, that's if he's the father, and then the defense, oh, no, we know he's the father. It drilled into your mind, yeah. The prosecution's made a lot of mistakes. I really thought if that was me there, that's like what I thought she was figuring out. That was like a gift to them. I just can't believe the prosecution didn't understand that. It's like, I don't know. And I just can't believe Dr. Brady didn't pick up on that. About when the baby could have been conceived and when the last menstrual period could have been. They have the DNA, the defense guy drives me nuts. Prosecutions are a bit not with it. I just don't know why they didn't have the wheel. They should have gotten a wheel from an OBGYN office. Or they could order, I think they can order them right on Amazon. They could definitely make the case that she conceived and her last period was early in July. Or ask anyone's phone. Yeah. I just can't believe. I really thought that's what she was figuring out over there. It's add 7 days, count back 3 months. And say she conceived on July 27th. And that, on average, was the 14th day of her cycle. Right? Then her last period would have been on July 13th, and that means her baby would have been due April 20th. Okay? So then that would be April 20th. She would be 40 weeks. She would have been 40 weeks when she went to the doctor. Now they're going to say, okay, now we've got the growth thing. But no. Her baby was very engaged. She was ready to give birth, which she didn't know. So she could have easily lost 2 centimeters there. It could be 3 centimeters off. Put her at 37, okay? And say she was 39. She could just be a smaller girl. I don't know. I'm not. And if he did it with his hands, there was a higher level of error. And yeah, the femur, yeah. I don't know why they didn't go. I would have gone through several dates in there from the last part of July. What does he mean by the last part of July? The last week? Lady very detached from her body, her life. Who, Christo? Skylar? No, the mother can't be there, Lisa, because she's going to testify. So she can't be in the courtroom. I don't know. They didn't talk about absences from school. They act the same. Unless her mom was blind, she must have known. Does anyone consider that this might have been her second baby? Yeah. Either that she could have had an abortion. Who knows? This happened before. Whatever. Yeah, that's a weird. I can't believe they haven't. There's so many things they haven't centered on. Skylar, you're not coming home. You're not going to finish that popcorn. I'm going to eat it. If this was her second, all is my mind. We'll do a little. I mean, they've got to get her on the evidence and the corpse. That's a no-brainer. I don't know. Why would he? That seems like a weird thing to say. It's very strange. She does have friends, Catwoman. She has friends that went to Teen Vogue. I read the article, that are standing by her and also saying don't, they were upset about how the town and stuff is treating her. Hi, Sarah. Also strange, her AOB. She seemed to know a heck of a lot for a first-time mother. Well, when are we going to actually see the searches completed on her phone and everything? Yeah, I think the mother digging through her pocketbook was some type of sign as well. And the OB saying that he says that to all women in their third trimester. No one has ever said that to me in my third trimester. Oh, that's normal. We say that to all women in the third trimester. Really? In Reels? Is it a new special about Chris Watts, or are they doing the one from Investigation Discovery? Because sometimes they re-release that stuff. Are you sure it's a new special and they're not recycling the Investigation Discovery? It's brand new? Who is it produced by? What's it called? You saw a commercial? When is it on? You never had a doctor say, I know. Hey, listen, it's good appointment, Dan. Listen, if you're thinking of committing suicide, give me a call. I can check the 15th. September 15th. It's Jimmy's birthday. Why did Zoe get taken back to the hospital? Well, okay, first of all, Helen, yes, that's why, because it's something more. It's not hacking, okay? I know that a lot of you think she was coughing. She's not coughing. She's retching. He even said she's retching. It's not a cough. And when she vomits, she's not vomiting food. She's only vomiting usually some water and a little bit of white foamy stuff. And sometimes nothing at all. She just retches. I've got to figure out when we're going apple picking. Oh my gosh. I can't remember when we went last year. In Ireland, a teenage mother gave birth to her baby in a grotto and both died. Oh dear. Yeah. I don't know, Evie. I'm really worried, and I'm starting to get worried about all my other dogs too. They check the kidneys. The kidneys are fine. Kidneys are fine. Don't say that. Don't say bad luck day. There's a lot of people that are born on the 13th. That's only just a state of mind, Maria. A lot of cultures consider the 13th lucky. Seriously. The lifting of the leg, like Jimmy was thinking the Maltese was a drama queen, but it could be a sign of Lyme disease. And then my bulldog is like, her nose is runny and stuff. So I don't know what the heck is going on. But I told him, he's like, oh, one thing at a time, one thing at a time. We don't use any pesticides. I'm completely organic. I don't use any kind of pesticides. I have one born on the 13th. No, it's not even unlucky then, Jeannie. It's not. It's all a state of mind. Chinese think 13 is lucky, and exactly, Diana. And Italians think, over in Italy, think 13 is very lucky. Lucky 13. So it's just your state of mind. Thanks, Maria. And teasel root extract. Add teasel root extract to drinking water. Teasel root. Hey, you go, girl. I remember 2001 was Good Friday. Zoe still, it sounds a bit like, no kennel cough. She's not coughing. It's not a cough. It's a retch. I meant, nobody uses pesticides here. It's a very proactive about the lake. There's a lake stewardship. Yeah, it's really, oh, you're being facetious. Love that. You look tired. Oh, thanks. You look tired. You like shit. Could the dog food be a problem? No, I don't. It's not the dog food. I mean, it's not. I don't even think it's the Lyme disease, Sonia. I think it's something else. I'm going to go to the Westy forum. See if anybody's had that. I'm like freaking out though. I just like. I wish there was like a little litmus thing I could give the other two Lyme disease tests. And wear gloves. Oh yeah, they definitely use pesticides on the golf course, yeah. Pulmonary fibrosis. Diana, they have her hooked up to IVs. They gave her a shot to stop the vomiting, which it's not their, just monitoring her really. They started, I think, some different antibiotics and might be some more medications. No, yeah, no, I don't have any neighbors close to me like that. No fever. No fever. But she's been eating, and now we're trying to think about it. I don't think she's been pooping a lot, so I'm wondering if the obstruction is further down. But then, how long could she eat like that and not poop? Because she's not vomiting food. No, he's not close like that way to me. Would show up pretty, yeah, she's had a lot of blood work done. Yeah, they're going to, he said if she doesn't get any better, he's going to scope her again. And if he can't find anything, he's going to cut her open, is what he said. She's a Westie, yeah. You would start to vomit at week 3. Leather won't show on the x-ray. Took them out. Oh, Karen, huh? Did she start having problems soon after you powered on? No. Not really, no. Not with what she's doing now at all, no. The bone lodged in his back, and then they had Diana, you had a dog that had a bone lodged in his back passage, and they had to remove it? We don't give her bones, though. You stop eating in week 2, so since she's eating, I'm confused. I don't know. I'm like freaking now. Yes, absolutely confirmed. But he doesn't even seem worried about the Lyme disease at all. They'll see a backup of stool on the x-ray after a couple of days. We never give rawhide. They never have rawhide. Yeah, $1,200. I'm about probably up to that right now, without the surgery, without the other scoping, without my other dogs going in to be tested for everything else. It's crazy. I can't even believe this. I don't know who gave him a bone, but I will say he was happy once it was removed. Yeah, what a summer. Oh, gosh. Have another x-ray. Really need to get to another vet. Yeah, I'm trying to figure out what to do, Maria. So I'm trying to figure out. I'm going to go to the Westie forum and see. See if he'll do an abdomen scan or x-ray. Maybe he didn't get the whole bowel in the last one. Can they do a barium on a dog? Second opinion. There's a really big Westie forum that I belong to on Facebook. I mean, like thousands and thousands of Westie owners. Is she miserable now? See, that's the thing. He's like, she's such a good dog. He's like, she's still wagging her tail, but like we said, well, you don't know how peppy she used to be. She's a very tough dog. Like, she'll never want to show that she's in pain or anything. He ate wallpaper wood molding. They are so feisty. Yeah, I'm gonna sign off in a few minutes here. I'm just trying to see if anybody else has any, and I'm gonna look up this stuff and then go on the forum. It doesn't see. Our vet Our dog will wag his tail. Yeah. Cost us $3,500 for 3 days. For a cat, and all they did was the MRI and IV fluids. Yeah, MRI. Yeah. It's crazy. It's absolutely crazy. Yeah, I know. Because he wants to do another scope, and the last scope was almost 600. So, and then a surgery. Yeah, I don't have pet insurance. Doesn't seem like any of the symptoms. Yeah, I don't think he's thinking it's the Lyme disease that's doing this. Yeah, I'm going to figure out what to do. Let me see. Please get a second opinion. Yeah, okay, Lisa. Good night. If he's doing another, tell him it's free. Exploratory surgery, yeah. Hey, William. All right. Yeah, I'm going to go do some research and go to the Westy group and see if I can find anything out. All right. Everybody take care. I will see you tomorrow. Let me see here. How do I get out of here? Thanks to our moderators. Thanks to everybody. Oh, you're welcome, Diana. Thanks. How do I get out of here? I can't see I've got so much stuff in front of my other screen. Okay, good night, guys. Thanks for the prayers. Keep them coming. I've got them coming for all of you.